hypertensive disorders in pregnancy. We have the pregnancy-induced hypertension, preeclampsia, we have eclampsia, we have chronic hypertension. Then the last one is chronic hypertension with superimposed preeclampsia. With the pregnancy-induced hypertension, mostly it's related to pregnant women who are not hypertensive, but by virtue of pregnancy, during the formation of the placenta. After placenta formation, that is from the 12-week onwards, the abnormalities are supposed to revert or to go back to its former state. Now, in a situation whereby this physiology is not able to reverse, then it leads to what we call vasoconstriction and then vasospasms. When this happens, it puts a lot of pressure on the heart, because the heart ideally, when it pumps blood is supposed to pass through these blood vessels without stress. But because there is constriction in the blood vessels, meaning that it's going to put pressure on the heart to work at a rate at which it will be able to compensate for that, so that blood flow can be sent to the vital organs as well as the unborn fetus in utero. So now let's move on to preeclampsia. With this, there is remarkable increase in blood pressure, that is 140/90 millimeters of mercury or more. And then when you do the urine check, it is noted that there is a urine protein of more than 1+. With this, we can say that the client has developed preeclampsia. And eclampsia is the advanced stage where the client goes into what we call fits or seizures. Then chronic hypertension. Obviously, if you are chronic hypertensive, does not mean that you shouldn't think of getting pregnant. So when you are chronic hypertensive, there's a high tendency that you may develop what we call superimposed preeclampsia. But with this, the superimposed preeclampsia mostly happens before the 20th week. That is early stages of pregnancy. That is how you're able to diagnose that this patient actually is having already a chronic patient, but due to the pregnancy or the placenta has developed preeclampsia. And then one thing too is, these kind of things, when you're a pregnant woman, bear in mind that most of the time, especially with the PIH, the cure is delivery of the placenta. Yes, the cure is the delivery of the placenta. In a situation whereby the BP2 is not even able to be controlled, that is where the doctors will advise that we do away with the pregnancy. Doing away with the pregnancy doesn't mean we are going to abort the baby, no, but the baby may not be able to get to term. So mostly such babies are born preterm. And also some of the complications are that the mother may, because of the constriction of the blood vessels, there may be what we call placental insufficiency. Let's try as much as possible to visit any nearest health facility as soon as you are able to, or as soon as you get to know you are pregnant. Don't wait. These things mostly occurs during the early stages of pregnancy, and if you don't visit the hospital early or on time, these abnormalities may not be able to be detected early. Thank you very much, and thanks so much for listening. If you have any questions, type it under the comment section. Have a nice day. Bye.